Thank you for joining us at this long-deferred celebration of 7 great urology professors, 1 generous donor, and the idea of endowed professorships. Why are we here at this moment, and why does the Department of Urology at the University of Michigan exist? We are here for tomorrow, the tomorrow of our students and residents, the tomorrow of our specialty, the tomorrow of our patients, the tomorrow of our staff and community, and the tomorrow of our children, personally and generically, and especially personally in the second row here. Universities are the single organizations in our world built for tomorrow, and they are quite durable. I've repeated the following quote before, but it's worth reconsidering. A report by the Carnegie Council in 1980 began by asking how many Western institutions have shown real staying power across time. Taking as a starting point 1530, when the Lutheran Church was founded, some 66 institutions that existed then still exist today in recognizable form. The Catholic Church, the Lutheran Church, the parliaments of Iceland, and the Parliament of the Isle of Man, and 62 universities. No Dow Chemical, no General Motors, no Ford, no Siemens Corporation. These are all universities. Universities in the past have been remarkable for their historic continuity, and we may expect the same characteristic in the future, the quote goes. They have experienced wars, revolutions, depressions, and industrial transformations, and have come out less changed than almost any other segment of their societies. And this is a powerful observation. For all their maddening features, such as medieval hierarchy, guild mentality, ecclesiastical titles like provosts, deans, or chancellors, indentured workforce like our residents, elitism, resistance to change, decentralization, and even the Fleming Building. Universities function primarily to educate the next generation and advance knowledge. Medical academia has become the dominant piece of most modern universities, and this is totally appropriate, I believe. The education of tomorrow's physicians and scientists is a fundamental necessity of society. Medical academia has a triple mission: education, clinical care, and discovery, a more inclusive term than research. Yet from this triple mission comes our essential deliverable, the epicenter of medical education and discovery, and this is kind and excellent patient care. And that's what this celebration is all about. This essential deliverable is the dialogue of clinical medicine. It's our distinct social compact. We will help you, the patient, with a problem in your life, and you will help us, the healthcare workers, practice medicine and become better professionals. That's our social compact. One of the great University of Michigan professors, physiologist Horace Davenport, Jim Stanley would have known him, Horace used to say that to the physicians he was teaching, he would tell them, you will become attendants at the service stations of life. And the essential deliverable of clinical care is the context and milieu of medical education and discovery at the service stations of life in this moral epicenter of clinical care in a medical school. Well, today's celebration, as I said, is long overdue. The 7 professors we honor today have been consummate attendants. For the kids, that means the very best, the best there is. Consummate attendants at the service stations of life, great clinicians and the best of the best surgeons. And you're probably thinking, wait, you just said 7 professors. I thought this event was only for 3, as you recalled the invitation. But we have to include Reed Nesbitt, the founder of our Department of Urology and the namesake of one of our professorships, and the 3 individuals who previously held these honors, plus George Velasquez himself. So first, a few words about George, our generous donor. George was a 1952 graduate of the University of Michigan Business School. He founded Velasas Communications, based in Livonia, the largest producer of freestanding newspapers in the United States. George established an annual student scholarship at the business school. He has made many other endowment gifts to the athletic department and to our orthopedic surgery department. A generous funder of prostate cancer research, George and his wife, Sandra, live in Florida and are unable to travel easily, but send their regards and best wishes to all of us today, especially our three professors. Jim Monte, a surgeon, was the first Velasas professor. Jim held urology together as section head in a time of turmoil and led Michigan urology to departmental status as our inaugural chair. He is currently active and inspirational in our Dow Health Services Research Unit. He created that. His Velasas professor has passed to Khaled Hafez, another great surgeons. Khaled is here with his wife a little bit, Mary Lee, and son Samir. And I know his father, your father, General Samir Hafez, would have been proud of you today. The Velasas endowment grew enough to spin off a second professorship, the George and Sandra Velasas Professorship, which went to David Wood. After David left us to become Executive Vice President and Chief Medical Officer at the William Beaumont Health System, the professorship passed to Ganesh Palapatu. Ganesh is here with his wife Anu and their children, Alina and Kirtan. His parents, Subi and Sita Subramanian from Houston, and mother-in-law Sesha visiting from India and Houston, and now visiting family in Houston, Nashville, Ann Arbor, but I don't want to say more about your travels than everybody else here today. But you are a traveling grandmother, sort of the envy of many of us. And cousin, Anjali and her husband, Alex Keller, from Austin, Texas. The Reed Nesbitt Professorship was created by the hard-earned dollars of our alumni and friends of the department. Reed Nesbitt led the urology training program here at Michigan from 1928 to 1968. His story is a great one, and we can send you information on that if you want to read more. The Nesbitt Professorship was first held by Ed McGuire, great thinker, innovator, and surgeon's surgeon, as befits the Michigan tradition. The Nesbitt Professor has now passed to Julian Wan, our departmental polymath and yeoman clinician, recently named Associate Editor of the Journal of Urology, and last week at our graduating Chief Residence dinner, he received an award from them, the annual Julian Wan Award, the first one that has been given. Julian's parents, Wei Ying and Ching Wan, couldn't join us this afternoon, but we congratulate them on their extraordinary contribution to our life here. Julian. Well, now let's hear some details regarding the recipients, beginning with Khaled. Khaled received his medical degree in Egypt in 1988, and after residency in urology and a period of further training in renal transplantation at the Cleveland Clinic, he received a PhD from Cairo University, where he was appointed assistant professor in 1998. Doesn't seem long ago. The most important part of his time in the Cleveland Clinic when he did his transplant fellowship was finding his life partner, Mary Lee, with whom he had a son, Mary Ellen. I have a great friend named Mary Lee. Samir, now 14 years old. Khaled's family changed the location of his career trajectory, destined for excellence anywhere in the world, but fortunately for us, Ann Arbor is where he landed. He completed a second urology residency here in Ann Arbor with grace and excellence. I had the personal great pleasure of working with him then, as I do today. He is a superb colleague, and he is our program director. Everything he does extraordinarily well. In 2012, Khaled was awarded the prestigious Medical School Clinician of the Year Award. Nominated by his peers, he received the National Top Doctors Award and Patient's Choice Award that same year. In 2013, he received the Compassionate Doctor Award, and in 2015 here at Michigan, he was inducted into the League of Clinical Excellence. There is no finer surgeon for complex urinary tract surgery anywhere. Khaled's surgical terrain encompasses the kidney, vena cava, heart, retroperitoneum, and the treacherous pelvic organs. I know of no kinder nor more generous physician, and in a few minutes we'll have Jim Monty present him with the award. Ganesh grew up in Texas, actually grew up in Montreal first, or Toronto, and was in the OR today. Could only do so much. Grew up in Texas, received his MD from Baylor College of Medicine in 1997. He trained in urology at UCLA School of Medicine, where I had trained in earlier times. When I met Ganesh as visiting professor 17 years ago, he impressed me even then as a resident. And I can say it's unusual to be a visiting professor for a few days at a place and then have a paper with that person come out a few years later. And that happened with Ganesh. Ganesh completed a urologic oncology fellowship at Johns Hopkins and became assistant professor at the University of Rochester. He then moved back to Texas at Baylor as chief of urologic oncology at the famed Methodist Hospital in Houston. In 2001, through a bizarre twist of fate in American medical academia, his title shifted to associate professor at Weill Cornell Medical College. Weill Cornell, a name I'd always associated with New York. But that was a funny glitch in time, but it certainly, maybe it helped us lure him and his lab here to Michigan in 2012. As division chief of uro-oncology, Ganesh leads a highly performing team and our largest division in the urology department. He's built up a very respectable laboratory, a robust clinical practice, and is an essential colleague in our department. Just like our other professors today, he's a superb surgeon and an excellent and compassionate clinician. And Julian Wan. Julian's a river rat. He grew up in Ann Arbor and went to Huron High School before graduating from U of M with a BS and MD when we had the Interflex program. I knew him as a medical student in my first year here on the faculty after I joined Ed McGuire. Julian's father, now retired, was a distinguished member of our university in Asian studies, and we wish he could be here, but is not because of health issues. It was Ed McGuire's clinical excellence and mastery of urology, from the neurotransmitter level to the skillful and compassionate management of people with disabling urinary tract dysfunction. It was Ed, I think, who upregulated the urology gene in Julian's brain. Julian became a resident with us, then a fellow in pediatric urology, before taking an academic job in Buffalo in 1922, where he not only did great work, but also made a national name for himself with his writing and involvement in key national organizations of our field. Sadly for Buffalo, we lured him back to Ann Arbor in 2012 as associate professor. He's now a professor. He quickly made his mark as a respected clinical colleague, admired teacher. He received our Silver Cystoscope Award from our residents in 2004. He's managed our departmental informatics, and his brilliant idea of the consult database has translated into papers, to better quality care, and even more revenue for the department. Julian has taken the leadership in our residents' surgical technique training using his sharp analytical skills and patient intellectual persistence. Julian is a noted teacher at the national level, quarterbacking the annual AUA urodynamics course for a decade. He was chair of the American Academy of Pediatrics section on urology in 2012. He's a recipient frequently of the Journal of Urology Best Reviewer Award and was just named associate editor of the Journal of Urology. Julian is a yeoman colleague, a superb pediatric urologist, and unquestionably a leader and one of the best. So let me start now by having Jim Monty come down and present the first two professorships. Come on up. Do we have the medal? Oh, the medal is behind me?